friends from Marble City Pharmacy joining us this morning. Jared and Jacob from Marble City Pharmacy in Sylacauga, Alabama. Good morning to you, gentlemen.
Good morning.
Good morning.
This is Easter week, and y'all dress apart, I see.
It was the next thing up in the closet.
That-
you know
yeah,
what I mean?
there's a rotation.
Yeah. You Auburn guys, you got the orange, but no blue.
Yeah, I don't know what this is for.
It's probably like Baylor or Oregon or something.
Yeah, who knows?
I guess so. Appreciate you guys coming this morning. Something that a lot of people deal with, we don't talk very much about, is blood clots.
Blood clots.
Yeah, and that's the topic this morning. And I guess there's a whole lot of different blood clots, aren't there?
Well, just to be specific about what we want to talk about today, because we're going to need to narrow it down. There are a number of types of blood clots. To make it as simple as we can, there are some blood clots that form in your arteries. Those blood clots are the things that will break off and go to your brain or your heart.
And that's not good.
That's not good.
Usually bad, yes.
Cause a heart attack or a stroke. But that's not what we want to talk about today.
No.
Today we want to talk about blood clots that happen in your veins, all right? You may have heard the term deep vein thrombosis. So blood clots in the veins usually happen in the leg. Most of the time they're in the lower leg in the calf area. Sometimes you'll see them in the thigh. Sometimes you'll see them in the hip area, pelvis. We'll talk about that after surgery here in just a minute. Even less common in the arm, but they happen in the periphery, they happen in the veins. So that's what we want to talk about today. Blood clots in veins, deep vein thrombosis.
Jared, who does this happen?
He called me Jared. That's painful.
I got mixed up with that teal-looking shirt.
Just roll with it.
Yeah. Who does this affect?
That's a great question. And the answer is it could be anybody. It affects people. It always starts the same way, whether it seems like a big deal at the time or not. There is something, injury, illness, infection, surgery, trauma, pick something, to usually that leg, that starts the process that you may not even think was a big deal. And at that point, you've caused an injury, an insult to that vein, which makes it more likely to form a clot. So it can happen to anyone at any time, although it generally, let's be honest, you know this is coming. You already know what the answer to this is, don't you? It generally happens to those 60 and older.
So while you're talking, what are some of the dangers of blood clots?
Well, the biggest danger of a deep vein thrombosis, the biggest danger of a blood clot in a vein, in the leg, in the thigh, in the hip, is something called a pulmonary embolism. That's when part of the blood clot breaks off and travels to the lungs. And when it does, it cuts off blood flow to the lungs. And of course, that's very serious, right? When it does that, you can see shortness of breath. You can see chest pain that gets worse when you take a breath or when you cough. You can see more rapid breathing. So those are just some of the things that might happen if that happens. That's obviously a serious condition. That's a situation where you have to go to the hospital. You have to get some thrombolytics or clot busting type drugs. But that's the biggest issue with a DVT.
What are some of the causes?
Well, we mentioned, that primary cause, that injury, but we've all had leg injuries, right? We've all had things hit us, bruise us, injure us, infections. We've all had those things. We didn't all have deep vein thrombosis, right? So while those are the causes, what differentiates one person from the next is risk factors. What are the risk factors of you with a leg injury getting a clot versus me? We mentioned age already. That's a big one. Obesity is a big one. The heavier you are, the more likely you are to get a clot. Prolonged sitting, laying, bed rest, well, how do I prevent that if I've just had a major hip or knee replacement surgery? Well, you're in bed for a while, and so we got to deal with that with medicines and things like that. But that's a big one, sitting, not moving. Smoking, that's pretty much on every list we ever make here. I've just drawn blank. We mentioned age, smoking, cancers. You got cancer, makes you much more likely to develop blood clots for any number of reasons. Women on any form of hormone replacement, birth control, estrogen, anything like that, makes you much more likely. And that's your big list right there.
Jared, you just don't wake up in the morning and say, hey, I got a blood clot. How do we know?
Well, the truth is, I'm glad you said that, because most of the time you have a blood clot in the vein in your leg, you don't know. You don't know. If there are symptoms, there can be some swelling, there might be redness at the site, you might have some pain, and it can be warm to the touch. So those are the four things that you look for, and I'm pointing to my calf under the table. Apparently you probably can't see that. Anyway, those would be in your calf area, so swelling or pain or redness or a warm spot. Those would be the indicator signs that you need to go get that looked at for sure.
So, can these prevent it? Can they be prevented, clots?
Yeah, and we try to be very preventative with these things. Your doctor, for instance, if they're going to do surgery on you, and they know you're going to be laid up for a while, they're going to put you on blood thinners. They're going to try to prevent it that way. So medications treat it, and we'll talk about that in a minute. But medications also prevent it. So they'll put you on blood thinners for prevention when we know there's a big risk factor coming up. Moving around prevents it. Keeping your weight off prevents it. Quitting smoking prevents it. If you're a woman of a certain age and you've passed an age that you necessarily need to be on an estrogen product, coming off those medications helps prevent it. And one of the simplest things, we're here thinking about pills and chemistry and all that stuff, but one of the simplest things that we sell that people use is compression hose. Compression stockings, they're not comfortable. Nobody likes them, but they're a cheap, simple, easy, no side effect, no problem way to keep the blood in your legs flowing properly and prevent blood clots. Get a pair of compression stockings for $20.
Do y'all have those in the store?
Absolutely.
Oh, yeah.
Absolutely. And nobody likes to wear them. I've tried them one time because people complain. I figured I need to know. Got me a pair, wore it for a couple of days. Thought, oh, this is no fun at all. But there's no side effects, there's no problems, and it costs about $20, and you can get a pair of compression stockings that prevent blood clots when you know you've got a risk factor coming up. And so it's a lot of ways to prevent it.
I hear a lot of people talk about they're taking blood thinners.
Oh yeah.
And when we look at this, talk about other treatments that are available today for blood clots, and we don't want to overdo this, but a lot of people die from blood clots.
We have, talking about treatments, we have a lot of people on blood thinners. I don't even want to hazard a guess at what percentage of our older patients are on blood thinners, but it's a bunch. And there are different reasons that people take them. We won't get into that today. There are more reasons to take blood thinners than just blood clots, so understand that. However, when we talk about treatment, if it's a very serious thing like a pulmonary embolism like we talked about, you get in the hospital, they're going to give you thrombolytics, which is just a fancy way of saying clot busters, drugs to try to dissolve those clots, all right? Outside of the hospital, you have medications. Some of them are injections, some of them are pills to thin the blood. We'll talk some more about that in just a minute. And then, like Jacob said, sometimes you use compression stockings for prevention. But also, sometimes you use compression stockings when you actually have a DVT. And if it's in the calf area, you'll wear it just up to the knee. If it's in the thigh area, you'll wear one that comes all the way up to the thigh. If you already have a blood clot, you'll use one with a much greater compression. Much tighter, much more difficult to get on, but necessary at the time.
So, I'm sure there are side effects from interaction with blood clots and blood thinners. Talk about that a bit.
Well, people hear all the time, and let's say, hey, I don't want to take that blood thinner. I hear there's just tons of side effects. Well, okay, so there's one side effect that's common to all blood thinners, and that's, you don't clot as well. So if you cut yourself, you bleed a lot more. There's a risk of bleeding. That's with all of them. But I do not caution people. I inform people. All these things they've heard about, going on a blood thinner, I've got to not eat this, not do this, watch out. Most of those things that are in their mind are for one specific blood thinner, the one that's been out there forever and a day. It's Coumadin. Everybody knows Coumadin or warfarin. That's the one everybody thinks of. And yes, when you're on Coumadin, it interacts with pretty much every other medicine you take. We got to be aware of that. How many interactions do you have? That affects your dose of Coumadin and how to take it. Foods you eat affect Coumadin a huge amount, especially leafy green vegetables, things that you need for health in a normal way work against your Coumadin. There's things you got to watch out for there. Timing of day, all these things you've heard about your entire life with blood thinners being a nightmare, those really only apply to Coumadin, and it's manageable. We can work around it, but we have a lot more drugs these days other than just Coumadin. That used to be our only choice. Now there's 5 to 6 other ones that we can do that don't use that don't have those problems, so to speak.
So people watching this morning and they kind of fit in some of those categories you're talking about. What do they need to do?
Well, they need to do, like Jacob said, one of the things you need to do is to move around. We talk about, any of you guys have had a hip replacement, knee replacement, that sort of thing.
And that's pretty common nowadays.
Yeah, very common.
That's pretty common. they're going to get you up and moving as quickly as they can after surgery, because these kind of surgeries that cause damage to these veins and then lying around in the bed after that, those are like a what's the word? Major risk for blood clot. And so getting up and moving around, staying active, losing weight, stopping smoking, no doubt.
So if people watching this morning and think, well, maybe I've got symptoms of this, what direction they need to go?
Depending on how far along the pathway you are. If you're starting to have that redness and, the swelling, the heat, that kind of thing, that's a call your doctor kind of problem. Mm-hmm. Hey, let me get seen. They may run tests, that sort of thing. If you're having the lung symptoms, that's a 911 problem. That's not a call your clinic. That's a 911 problem.
It's a life and death thing.
Yeah, it depends on where you are in the process. But if you're having that breathing issue, that's a 911. Don't call your doctor's office and wait for them to call you back. That's a 911. If it's I've got a clot in the leg, that's not necessarily a 911. That's a call your doctor's office. Hey, it's it's red, it's swollen. What do I need to do? And they'll bring you in, I'm sure, and they may even send you to the hospital. But that's not necessarily that crazy emergency that the lung problems are.
Jared, this is not in my notes. Has nothing to do with blood clotting.
Oh, even better.
I'm ready.
But I saw it on my car just the other day, and it kind of looks like the color of his shirt.
Oh no.
Got to be pollen.
Yeah, it's horrible right now.
It's horrible. Listen, if you live in Alabama, it's almost impossible to avoid these types of seasonal allergies. And I would say right now, this is the number one question that we're getting. So, in pollen season, just be thinking about your preventative type medicines. All right, your preventative type medicines. You got your once a day drugs like your Claritin, Allegra, Zizal, those. You got your ones that work faster, that are more immediate, like your Benadryl and your chlorotrimazole, although those generally make people pretty sleepy. And then you have, once you're already into the symptoms, right, you don't just have the runny nose and the sneezing. A lot of times you have the congestion. You're going to have to add Sudafed to a lot of those products, or maybe a nasal spray that's a good decongestant to get some relief.
How many people come in the drugstore and say, I don't know, Jacob, I got the flu, I've got a cold, I've got allergies, and a lot of the stuff is the same.
It runs together.
Look,
honestly, right now, multiple times an hour. It's let's stop what we're doing for a minute because someone has come in, and I mean you see them from 10 yards away. You know exactly what they're in there for. You can see it. And that's
bags under their
that's
eyes.
multiple times an hour. At this time of year, it's constant.
hey guys, thanks for coming this morning.
All right,
appreciate
enjoyed
it. And blood clots. If you need more information on this, you're the guys to go to, right?
That's right.
That's the rumor.
What about your Facebook page and all that kind of stuff? You got anything on Facebook?
That's
Not
a great
about
question.
blood clots,
Not
but
about
we
blood
can.
clots.
No.
That's right. And this segment will be there before the day's over.
There you
That's
go.
right.
Hey, we got more to do on Daybreak Live. We'll be back right after you watch this.